Good afternoon. I was sitting where Alan was sitting just last week on our Global Violence Prevention Forum as co-chair, and it's harder here, I'd just like to say, than it is over there. But I'm delighted to be here. I'm delighted that this committee is happening, and then I get to be part of the dialogue. First of all, my first point is that when you're looking at gun violence, when you're looking at domestic violence, when you're looking at homicides, you need to disaggregate by gender. The dynamics when women are killed are different, or when women are almost killed. And for instance, 40 to 54% of women who are killed by a husband, boyfriend, or ex-husband or ex-boyfriend. And that's in comparison to 5 to 8% of men. Most homicide research, even though back in 1989, Jim Mercy and Linda Saltzman said, you got to disaggregate by gender when you're looking at homicides, people don't. You know, their first line is so many women killed, so many men, and after that, they're lumped together. Yet, homicide of women is the 7th leading cause of premature death in this country. It's the #2 cause of death for young African American women, no matter premature or regular. And it's the #3 cause of death for American Indian, Native Alaskan women, young women. And when women are killed, in at least 2/3 of the cases, they were physically abused by a partner or ex-partner beforehand. And when a man is killed by a partner, there's been prior wife abuse in 75% of the cases. So the dynamics are very different. Women are more at risk when they're leaving or have left. That first 3 months is a very dangerous period, and the whole first year is also dangerous. And that's the time that there's most likely an order of protection out against the abuser. And yet we don't do a very good job in removing guns from known domestic violence offenders. We've also seen an uptick in rural domestic violence homicides. The relationship to guns, gun prohibition, implementation, and enforcement in rural areas is unknown. It's another unknown research question. Women are far more likely to be the victims of homicide-suicide than are men in partner relationships, and this ties into the suicide data that we were looking at before. The other part that we know is that 40 to 47% of our intimate partner femicides, women who are killed by partners, were in the healthcare system in the year prior. We don't know how many of those were there with gunshot wounds. When women are killed by intimate partners, 19% of the cases also includes the homicide of a child. Yet that data is hard to separate out from general child homicides. For every one woman who is killed, there's approximately 8 to 9 attempted homicides. And it was mentioned this morning about the near misses. It's a very important category. It's very hard to figure out those cases. The other way that children are affected is they oftentimes witness the attempted or actual homicide of their mother, or the first to find the body. And when we talk about developmental characteristics, developmental trauma, that's a huge one. But we generally don't reach out to those kids and make sure that they are provided with the appropriate kinds of interventions. And women are killed when they're pregnant or in the postpartum period. This is now the leading cause of maternal mortality in the entire state of Maryland and many other states. The second leading cause of maternal mortality in most states. Yet most of our maternal mortality reviews that are done in every state in the health department exclude homicide because it's felt those maternal mortality reviews are done by physicians, and it's felt that homicide is a criminal justice issue. And yet those women are seen in our prenatal care systems before they are killed, and we are failing to identify them as being abused and therefore potentially a homicide victim. 61% of the intimate partner maternal mortalities were done with guns in the state of Maryland. We have the National Death Reporting System now. It's a wonderful advance. We only have it in 16 or 17 states, depending on how you count. By executive order, it's to be increased to all 50 states, but we don't yet have the funding for that. That will be incredibly important. One of the aspects that's counted there is Femicide. This is when a family member kills another family, more than one family member, other family member. These are most often intimate partner homicides, and then the perpetrator kills either another child. A child is the most common scenario, along with killing the wife or partner and then killing himself. And 88% of those kinds of cases, there was a gun used. These are the 10 top states in femicide in 2010. And the ones in black have no gun possession prohibitions with domestic violence orders of protection. And the one, Virginia, has only prohibits purchase and transport, not full possession. And the Texas and Arizona also have weakening provisions with their gun homicide removals. This is just a snapshot of the femicides that have been counted. This is using the supplemental homicide reports with a remarkably similar percentage of those committed with a gun, over 50% in all but 2001. Now, one of the other issues with domestic violence homicides is oftentimes that ex-boyfriends, ex-girlfriends are not categorized. They only started doing that in BJS in the 1994 data. They didn't start publicizing it until 2007. And as you can see, it adds approximately 600 women being killed every year. And a lot of our aggregate data on homicide, even on domestic violence homicide, doesn't include those ex-boyfriends, ex-girlfriends. So we have found over time, as that slide shows, that we have had a decrease in intimate partner homicide over the past 25 years, a quite striking decrease, especially for men being killed by intimate partners. What this has to do with is increased laws and resources, exposure reduction, but very importantly, removing guns, or at least disallowing possession of guns from known domestic violence offenders. With the Brady Bill, became prohibited for anyone to buy a gun if they have been convicted of a domestic violence assault. And we have early research by Arthur and others in terms of how much that gun in the home increases the risk of homicide. We have good data from in 2006 where states where purchase restrictions are in place, where orders of protection go into the federal database, and order of protection possession prohibition decreases the intimate partner homicide and firearm homicide by 12 to 13%, overall by 10%. So really good data. We have this supported in a recent article that was published by April Zioli and Daniel. And so also often the implementation, even when we have those state laws that prohibit possession, is a challenge, even though it was upheld in 2009 by the Supreme Court. So to summarize, I'm stuck, there we go. In terms of the guns and without guns, in terms of intimate partner homicide, we've had a definite decrease over time as we've had those gun prohibitions put in place, more gun removals, but we still have the majority of intimate partner homicides with guns, especially for women. I want to show you a little bit of data from our femicide risk study. Daniel Webster and I conducted this study, a main publication in 2002. We were trying to establish the risk factors for intimate partner femicide over and above domestic violence. Great interdisciplinary team. including Arthur Kellerman, who helped me design this bloody thing along with Daniel. And these are the cities that were involved. I can tell stories about getting this sweetie funded. I think it was like the 4th iteration of the proposal. I finally got it right. But we were able to do a case control design where we used the police homicide files, and importantly, we interviewed a proxy for the woman who was killed. We interviewed a family member to get the details, because they won't be in the police homicide reports. They won't be in the supplemental homicide report. They oftentimes won't be in the MVDRS. So this is an important aspect of doing homicide research, especially if you're trying to figure out what led up to it. Our controls were women who were physically abused by intimate partners, and we also added a second set of cases, which were women who were almost killed by their intimate partner. Now, these attempted homicides, as I alluded to, are a very important area of research that's very hard to find. There's not any nice systematic database you can go to identify attempted homicide victims, be they gunshot or non. Our criteria was gunshot wounds or stab wounds to the head, neck, or torso. These women could have, should have died, except for some great health intervention, quick health intervention, or some stroke of fate. These were very hard to find. Gun injury records are kept in some jurisdictions, not all. And these women were very hard to locate, because so would you move from a home where you were shot or stabbed if you possibly could, if you had the resources to do so. These were our abused controls. This was the sample that we did the multivariate analysis in. And just to point out the gun data, the victim, a woman killed by a partner, whether or not she owned a gun before the homicide occurred, neither increased nor decreased her risk. It was not protective. The men who killed their partners, 74% of them were gun owners. Gun owners. This is not gun access, this is gun ownership. 53% of the men that almost killed their partners were gun owners before the event. It's not a gun they went out and got just before they killed her. 27% of the abusive men in those same cities were gun owners. And 13% of non-abusive men were gun owners. So if you buy a gun in Baltimore because you think it's a dangerous city, you're twice as likely to do so if you're an abusive man. 4 times as likely to do so if you're an attempted homicide perpetrator. And 6 times more likely if you're an actual perpetrator. We also looked at, this was very hard to do, we had incomplete data there. Just to summarize this, about 1/3 of the men who tried to kill or actually killed their partner should not have had a gun prior. They either had a domestic violence restraining order out against them, or they had been convicted for a domestic violence assault. Our risk models, just to point out, prior gun ownership increased the risk by 5.5 over and above prior domestic violence. These are adjusted odds ratio. I also want to point out that unemployment was the only demographic feature that drove this. Outweighed race, outweighed income. It was the one demographic issue. The perpetrator using the gun at the time of the incident increased the risk of her dying by an adjusted odds ratio of 24. That's one of those duh research findings, you know, increases her risk of dying a lot if the gun is used, but it's important. The homicide suicides, partner gun ownership increased in adjusted odds ratios, increased the risk of a homicide suicide by 13. This is where he kills her, then kills himself, and a gun was used for that homicide in 62% of the cases, but even more so when he killed himself, a gun was used. There's prior suicide threats were a risk factor for these homicide suicides, oftentimes not taken into account. So I just want to wrap up by saying the role of judges in the implementation of prohibitions is very important, and doing research in terms of what judges can do so that judicial training can include things that judges can do. And that's something we oftentimes forget in terms of our system research and in terms of our prevention research. We need to make sure that state laws prohibit possession with protective orders and with emergency protective orders, not just the long-term ones. That's only true in about half the states, although it's increasing. Laws vary a great deal state to state. We need to look at which ones really are the most effective. Disarming and removal is only in about 8 states, but judges can still order removal. The gun storage issues, police departments say, yeah, but what am I going to do with all these guns? You know, where am I going to put them? You're like, okay, so we could solve that. That's right. Needed research, NVDRS expansion to all 50 states, as I mentioned, but we need to do some checks to make sure that these ex-partner categories are in the NVDRS. We also need to make sure the domestic violence field now, which is only convictions, needs to expand to include arrests and protective orders so that we can really estimate how much domestic violence happened before. Even then, the actual domestic violence is going to be underestimated by as much as 60–80% in some of our studies. More of the NIJ, Office of Violence Against Women collaborations. We're now part of a technical assistance prevention of homicide, domestic violence, homicide collaboration with NIJ. They're going to do the evaluation. I'm hoping that evaluation will have a lot to do with the gun issues also. There's domestic violence fatality reviews. There's some potentials there to do more research. We need to make sure their reports are useful, that we have researchers on those teams. Our attempted homicides I've mentioned, and then we need to conduct some sort of a national study to replicate our findings in the intimate partner femicide study in terms of how many guns that were used in femicides and attempted femicides actually were prohibited. And I think that that would be compelling evidence for some of the states. Thank you. Oh, this is a quote from one of the moms I interviewed that I promised her I would always put up at the end.
Thank you, Jackie. Thank you very much to the 4 panelists for their presentations, for the provocative scope and challenges that they have presented, and really appreciate your contributions. Thank you.